you all to another episode of BII's Healthcare Dialogue series, where we usually endeavor to bring together global perspectives on the healthcare landscape, prevailing trends in the market, associated roadblocks, and new benchmarks for healthcare service delivery in light of the COVID-19 pandemic. So joining us today, we have two very special guests, and they are Farhana, the Senior Vice President, and Larry Lofgreen, Chief Technology Officer at Health Catalyst. I must also mention that Health Catalyst is the health tech partner of our upcoming Second Asia Patient Experience and Engagement Summit, scheduled to virtually stage at the 6th and the 7th of October. So to begin with, Farhana, tell us something about Health Catalyst and your role in the organization.
Sure, thanks, Zainab. So Health Catalyst is a leading provider of data and analytics technology and services to healthcare organizations. We are committed to being the catalyst for massive, measurable, data-informed healthcare improvement. And as you can see in our name, Health Catalyst, the whole idea is that, we believe that healthcare institutions are really doing the major frontline work. They're doing all the hard work. We're really there just to help them use their data, analyze their data for them, and help them use the data to provide opportunities to improve their healthcare outcomes. So our solution really consists of three parts. We have a data platform which integrates data from hundreds of sources in flexible, open, scalable manner. We have analytics applications which are built to highlight opportunities for clinical, operational, and financial improvements. And finally, we have our professional services, which are really there to help our clients realize those measurable improvement opportunities. And so our services include our analytics teams. We have about 250 data analysts, as well as we have about 300 subject matter experts in healthcare that span across clinical, financial, operational areas. And so, as I mentioned before, we're very much a mission-driven company, and we measure our success on patients' lives saved or improved, or millions of dollars saved by our clients. And for us, the most important part of the work we do is to measure the outcomes our clients achieve, be it clinical, operational, or financial. But our hope is that that is actually going to improve the outcomes that they have. So we have about 1,000 people in the company. We have over 120 healthcare systems as our clients. While our headquarters is in Utah in the US, we just set up our Asia Pacific office in Singapore. And I was hired a year ago to head that business for Asia Pacific.
Great. And if you could also talk to us about some of your previous experiences and how you've transitioned into your role in Health Catalyst.
Sure. So prior to Health Catalyst, I was actually leading the healthcare and life sciences solutions business for IBM for about 18 years, where again, I was also focused on digital transformation and digital health across the healthcare industry. And prior to that, I worked in biomedical research in Canada and in Singapore.
Great. Thank you very much for giving us some background about your experience and expertise. That takes me to the other question that I would like to address it to Larry. Larry, first, I'd like you to speak something about yourself, talking about your role in the organization, and then your insights on capacity planning is the most important part of planning during pandemic situation like COVID-19. Can you explain about the capacity planning solutions offered by Health Catalyst?
Sure, and thank you for the opportunity to talk about some of these important topics, particularly with respect to COVID-19. So as far as my background, I recently moved to Singapore about a year ago to support the Health Catalyst expansion into Singapore. I've had many roles inside of Health Catalyst around the product development and product delivery. And so it really made sense for me to come out and just see how our product and offerings needed to be adapted from a technology and analytics perspective for Asia Pacific. Because while there are commonalities between care in the US and Asia Pacific, people still get sick. The resources that are available and the modalities that are available may differ a little bit. And one of the big differences is the economics, the payment mechanisms in Asia Pacific and the US are quite different. And therefore, because the economics have to make sense in order for healthcare to work, there's some differences that we have to accommodate coming to Asia. So that's part of where I came from, the US. Prior to Health Catalyst, I spent 15 years on the periphery of what I would call clinical care. I was doing pharmacy transactions and machine learning with respect to predicting risk around pharmacy transactions. So it's just translated into the more clinical and payer space in healthcare, or what I would call the majority of healthcare, quite well. I've been doing technology-based solutions for 3 decades. So been around the block a few times and have the scars and bumps and bruises to show for it. So with respect to capacity planning, it's an interesting topic. COVID has actually really shown how we are deficient in our capacity planning for a pandemic like this. If you think about where capacity planning typically happens, it typically occurs with respect to labor. So our care teams, and then with respect to supplies. It also will affect perhaps our bed mix in an acute care facility. And all of those have been impacted by COVID. But one of the things that COVID has really brought to light is we were thinking about, prior to COVID, we were thinking about capacity planning really in terms of efficiency. How do we spend as little as possible on acquiring, warehousing, personal protective equipment, for example? How do we optimize our bed mix and have our critical care beds not be too many, because we don't want those beds to be vacant? How do we optimize our care teams a certain way? And of course, that way included not having to gown up very often before going into a patient's room. Those are just examples. And so COVID came, and what we found is this efficiency model was not very resilient. And so what we've partially learned, and what we've helped with from Health Catalyst standpoint, is to realize that we now need to be efficient within a range. We have to be both efficient and resilient. And the way that you approach that, or the way that we approach that, is by creating machine learning models that can help predict, but can help predict within a tolerance so that we can help our clients and others identify where they want to be in that mix between efficiency and resilience. Do you want to prioritize efficiency? Well, you might choose that if you have a good stock of, say, personal protective equipment. If you have backstocks, if you have other hospitals in the region that you may be able to share supplies with, if you have a solid supply chain. Of course, our idea of what a solid supply chain is also changed with COVID, right? Because we saw how so many of the supplies were, for instance, coming out of China. And when China got hit first, that affected the world. It really was evidence of, the anecdote, when China sneezes, the world catches a cold. That's kind of what we experienced. But nonetheless, different healthcare systems are situated differently geographically, and therefore the balance between efficiency and resilience has to also be adjusted because of the operational realities of how long it takes to get additional supplies, and even what resources you may have available from a labor standpoint, also what the patient demographics might be. That's a long-winded way of saying, there's no silver bullet, but we have tools that we can address through analytics, probabilistic models that we can build that help health systems try to strike that balance, recognizing that we'll never get the answer perfect, but we can at least get closer. And so that's what we did early on, was create particular capacity management tools that we made available free on our website, to just say, here's the tool. You can put in the parameters that are specific to your healthcare organization. curve, as we call it, infection rates, how many patients might make it into the ICU, how many patients might end up on ventilators. You can really start to plan around those types of parameters and try to make a difference in how you strike the balance between efficiency and resiliency.
Great. That's some great insights. And that actually takes me back to Farhana, and I would like to ask, how does your patient safety monitor suite works to improve patient outcomes and lowest cost?
Yeah, sure. So, I mean, patient safety is a global issue, right? I mean, there's over 400,000 patient harm related deaths a year, and that costs more than $1 billion globally, right? And so there's always a need for health systems to find ways to improve patient safety. So what Health Catalyst patient safety solution does is it helps organizations to accelerate their journey to this concept of zero harm, which is really about really not ensuring that you're not harming your patients as they come to your health system, and basically building a safety culture within their organization as well. So what our solution does, you know, we really kind of do 4 things. One is we detect actual and potential harm to patients, right? And so that's really primarily using either client-defined triggers, or we create triggers as well, rules. It could be even through AI, right? And so this is initially, as I said, to identify early something that could potentially harm a patient or is actually harming it. So it could be a patient fall, it could be pressure injuries. I mean, just to give an example, at Allina Healthcare, we developed a trigger tool that identified more than 216 cases of hospital-acquired pressure injuries, which was more than, I mean, that we identified more than if it was voluntarily reported, right? We identified 216 more cases than if they had done it voluntarily. And so that's mostly the case. If you automate, you can actually identify things earlier and quicker. Second thing we do is once we've detected there's something potential harm or the actual harm to the patient, you have to intervene, right? So then it's really about alerting the right person to protect the patient. The next part is really about learning from the data, using pattern recognition technologies and applying best practice so that you can do some root cause analysis to understand what exactly is the cause of, you know, this potential harm as well to the patient as well, because you don't want it to happen again. And then the next part of it would then be to take those learnings, you know, do a clinical review of sorts and prevent the next cases. And so then you would want to mitigate future harm, right? As you go through this in care delivery and looking at the safety culture, and then basically understanding the capacity and the understanding of patient risk. That's basically how it all comes together. So it's really these 4 things that we do. And so as you can imagine, you know, obviously by early detection and response of patient safety events, you're, you know, improving the lives of patients, right? Because they're not getting harmed. And as a result of that, you're lowering your costs, because every time there's an additional hospital-acquired infection or there's a patient that falls, that's more cost to the healthcare system. So this is the way that our solution actually helps to, you know, improve patient outcomes and lower costs.
Interesting, really interesting. And so I'd like to go back to Larry once again, over to you. When we talk about data analytics, one thing which comes in our mind is data safety. So how does Health Catalyst ensure that the data is safe and secure from any potential data theft?
Yes, thank you. It's a good topic, and as the global economy has shrunk in the sense that people are closer together through communications, obviously data safety, as you term it, or data theft, is ever present with us. I would actually like to answer the question through 2 veins, however. When I think of data safety, I think of 2 aspects of it. One is the malicious external attack, somebody from the outside trying to come in and get the data that they don't have the right to have. The second is one that we don't talk about as much, but it's actually a greater risk. And that is the negligent mishandling of data inside of an organization that makes us perhaps use it erroneously and become unsafe, if you will. So with respect to the first one, the malicious external attacks, this concept actually will apply to both, but someone once said that when the time to act has arrived, the time for preparation has ended, right? That's the way it is with external attacks. When the attack comes, your ability to prevent that has ceased, right? You've done all the preparation that you can, and now it's really up to your systems. So the key for preventing or mitigating those attacks is really preparation. So for instance, within Health Catalyst, we have routine external audits. External third-party companies audit our security. We have a security team that is constantly trying to trick our team members, if you will, with sending spurious or phishing emails. And the idea is one of the main ways that attackers, external attackers, try to gain access is through social engineering. And so our security team attempts to mimic social engineering attacks within our company and then reports the results. X% of our team members fell victim, and we have thresholds. And so we see and recommend that other organizations adopt something similar, and that is have a team that mimics the types of attacks that you're going to guard against, so that you can actually determine how well prepared you are. And partly that changes as we bring on new employees, as we end up offering new services or things like that. We may open ourselves up to these external attacks without actually thinking about it. But if we have a culture of constantly testing ourselves, not so that we can necessarily feel bad, but so that we can feel good that we're prepared, right? That is one key element. And then second to that, like I said, the more prevalent damage, if you will, that is done to data is internally. It's by not understanding the needs to have data governance so that we have consistent definitions. We may have multiple ways of recording data that give different results. And yet often within the organization, we may act as if that data has the same meaning consistently, when actually data only has meaning in context. I'll give you an example of that is if we were to see in a chart a doctor that recorded something that said the patient is blue, we might conclude that the patient is cold and is turning blue. We might conclude that the patient is sad, because blue is a mood. We might conclude that the hospital had a color coding system for patient condition, and this was a blue patient. The point is, absent context, we don't have any meaning for that data. And yet too often, we don't think about that context, or we don't appropriately record that context, and therefore we can draw erroneous conclusions. So that's what I consider the negligent injury to the data that is just as pervasive, actually more pervasive than the external malicious attacks, or at least it's more damaging more frequently. And again, what do we do about that? We constantly educate ourselves. We focus on data governance. We constantly ask, are we doing enough to make sure that we are being consistent in establishing the foundation for quality analytics, whether those be advanced machine learning algorithms or whether they be simple charts. But we can't make good decisions to support, can't make good decisions if we aren't working off of common definitions. So preparation, raising the question as you appropriately ask, keeping it in the forefront of our minds, and having a process for constantly addressing the issue, whether that be from the external factors or from internal factors. That's really the key in our minds to protecting the data. And again, recognizing that protecting the data is not just about external parties, it's also about internal parties.
Exactly. I agree to that. And as the saying goes, that big data is the new oil of our times. I'm sure because in light of the acceleration of digital transformation, it keeps the healthcare entities more vulnerable to such data attacks. With the recent headlines of the news that we read about the Bangkok hospital, one of the leading hospitals in Bangkok just suffered or just faced a ransomware attack. And I'm sure it's big data that takes more importance, it takes more prevalence in the current date and time. So well said, Larry. Thank you very much for sharing your viewpoints on that. And this actually brings me to the last question that I like both of you to share your thoughts on. As the health tech partner at the Patient Experience and Engagement Summit next month, what are you most looking forward to?
Shall I go first? Okay, so yeah, I mean, I think, you know, when they say that it takes a village to raise a child, I think it takes a whole industry and ecosystem to improve healthcare outcomes. And, you know, Health Catalyst, we come in it from a data-driven approach, but the, you know, the lineup of speakers that BII has is fantastic, and everyone is looking at the same objective, but from a different lens. And so I'm excited just to hear from industry experts and from all over the world on, you know, what are their pressing challenges, what are the latest trends, and really just getting that opportunity to share our collective, you know, points of view and learn from one another. So that's what I'm looking forward to.
Thanks, Farhana.
Yeah. If I could take my answer back, I'd go first because Farhana just stole my answer. I couldn't agree more with Farhana. It's learning from like-minded individuals, but also learning from those who may have a little bit different perspective because the environment that they are operating in is also a little bit different. The culture is a little bit different. The patient mix is a little bit different. It's impossible for any of us to have all of the thoughts we need to have, to come up with all the solutions we need to have. And so these types of collaborations and being able to hear how others are addressing problems inevitably makes us all better. You know, it's the idea of when the tide rises, all the ships rise. And that's really what I'm looking forward to, right? Is seeing the collective knowledge level rise and all of us rise with it.
Thank you very much. That's exactly the objective of our event next month. So some great insights that you guys have shared with us. Thank you very much for your time today. We sincerely appreciate you sharing some very interesting viewpoints. So we have a key takeaway message here that healthcare was already evolving and was on its way to its path to digital transformation. However, the pandemic accelerated this and proved that the industry is capable of adaptability, agility, and innovation. Widespread integration of technology has been integral to containment and treatment processes in healthcare. As people become more mobile and more connected thanks to digital technologies, it is vital that healthcare providers open a digital front to revolutionize the patient and caregiver experience, which indeed is their ultimate common goal. So before we sign off, we would like to invite you all to join us to the virtual edition of the second annual Patient Experience and Engagement Summit, as it lines up healthcare industry chain makers and technology visionaries like Farhana and Larry, who are at the forefront of change. Do not miss the opportunity as together we celebrate and learn from the COVID-19 success stories to shape new frontiers in patient experience, health tech, and innovation. So for now, goodbye and stay safe.